vagus nerve. We already said that vagus has motor nucleus, the same like in glossopharyngeal nerve. Nucleus ambiguous, sensory nucleus solitarius, and autonomic nucleus dorsalis nervi vagi, number 3. In the region of jugular foramen, sensory fibers, the same like in 9th cranial nerve, makes 2 ganglions. I can draw both because it is not necessary to draw for you. Superior ganglion and inferior. Superior ganglion, it gives 2 branches. Superior ganglion gives 2 branches. One is meningeal branch, ramus meningeus, and supplies meninges in posterior cranial fossa. And it gives ramus auricularis, which supplies skin in the region of external ear and external acoustic meatus. All another sensory fibers of this nerve, that is continuation from inferior ganglion. Here is motor fibers and autonomic, that is vagus nerve. And your main task next time, you need to know which branches vagus gives on the head. I already said meningeal and auricular, on the neck, in thoracic cage, and in abdominal cavity. And they are pharyngeal branches, ramipharyngi. It is motor fibers, that is why vagus supplies all muscles of pharynx, except this stylopharyngeal muscle, because it receives innervation from
Glossopharyngeal.
gloss. It is 9th. This is 11th and this is 9th. This is stylopharyngeal from 9th nerve. All another palatopharyngeal muscle and 3 constrictors, musculus constrictor pharyngis superior, middle, and inferior. All of them supplies by pharyngeal branches of vagus nerve. And here the same, we have sensory fibers for pharynx. That is why pharynx, innervation of pharynx, pharyngeal branches from glossopharyngeal nerve, and pharyngeal branches from vagus nerve. And parasympathetic fibers here, the same we have. It goes to pharynx, continues interrupt in ganglion, and supplies pharynx. Then, what else? From these branches we have motor fibers, which goes to muscles of soft palate. All muscles of soft palate except one, except musculus tensor veli palatini. All another, levator veli palatini, musculus uvule, musculus palato glossus, and palata pharyngeus. All of them supplied by vagus nerve. And sensory fibers of vagus nerve, the same goes to root of the tongue and epiglottis. We already said it here. Root of the tongue and epiglottis supplies by vagus nerve. Vagus nerve. What else? On the neck, vagus gives superior laryngeal nerve. That is larynx, and superior laryngeal nerve, nervus laryngeus superior, supplies muscles of larynx and mucous membrane of larynx and mucous membrane. Muscles and mucous membrane above of vocal ligament or vocal cord, vocal ligament. Then, what else? What is it? And it gives vagus on the neck. On the neck, it gives ramus cardiacus cervicalis superior. Superior cervical cardiac branch, ramus. It goes to heart, the same like parasympathetic fibers, which goes to ganglion and then continues to heart. Then, if you have superior cervical laryngeal, should be what? Inferior cervical, the same. Ramus cardiacus cervicalis inferior. Superior and inferior cervical cardiac nerves, branches, rami cardiaci. After that, vagus goes into thoracic cage. On the left side, it passes in front of aorta, that is aorta. On the left side, it is on the left. On the right side, in front of subclavian artery. And here, in thoracic cage, first nerve, that is nervus laryngeus recurrens. And it continues into nervus laryngeus inferior. That is motor fibers, they goes to muscles of larynx, and it is the same. We have sensory fibers and autonomic, parasympathetic. And parasympathetic. And below from this place, below from laryngeal, recurrent laryngeal nerve, vagus consists only from sensory and autonomic fibers. There is no motor fibers below from this place. Last motor fibers continues into recurrent laryngeal nerve. Nervus laryngeus recurrens, and it continues into nervus laryngeus inferior. Then, what else? In thoracic cage, it gives rami cardiaci thoracici, rami cardiaci thoracici, rami bronchialis, and rami bronchialis goes to plexus pulmonalis and supplies lung. And it gives rami esophagealis for esophagus, rami esophagealis. And vagus makes plexus in esophagus, plexus esophagealis. Vagus nerve makes plexus esophagealis, and from this plexus we have, in the beginning, we have left and right vagus nerve. They goes to esophagus, makes plexus, and from plexus esophagealis continues anterior and posterior trunks of the vagus nerve. Truncus vagalis anterior and truncus vagalis posterior. Anterior and posterior trunk. This is anterior trunk and here it is posterior trunk. Anterior and posterior trunk, truncs vagalis. And these two trunks, together with esophagus, passes through diaphragm. This is esophagus, that is esophagus. That is esophagus. Here it is diaphragm, and esophagus opens into the stomach, yes? That is the stomach. And anterior trunk goes to stomach and makes plexus gastricus anterior and supplies stomach, plexus gastricus anterior, and posterior trunk goes to posterior side and makes plexus gastricus posterior. And posterior gastric plexus, plexus gastricus posterior, I write it, plexus gastricus posterior. This plexus gives rami целицы. Rami целицы. O-E-C-L-I-A-C. And continues to celiac plexus or solar plexus. Solar plexus. This plexus is mostly sympathetic plexus. Sympathetic. It is sympathetic ganglions, nerves. We will speak a lot. Today, it is necessary to know that ramiceliacy from posterior gastric plexus goes to celiac plexus, and from celiac plexus continues to all inner organs in abdominal cavity. For example, hepatic plexus, plexus hepaticus, goes to the liver and supplies it. Or splenic plexus linealis goes to spleen and supplies it. Plexus renalis goes to kidney. Here and here, plexus renalis. Plexus mesentericus superior goes to small and part of large intestine. Plexus aortica abdominalis continues together with aorta and then gives plexus mesentericus